Welcome back to another session class, and today's session will be continuing the course Human Resource Management, and today we'll talk about employee benefits and services. The learning outcomes of this today's lecture is explain the strategic role of employee benefits, describe 7 government mandated benefits, explain why the cost of health insurance benefits is increasing and how employees can reduce these costs. Further to the learning outcomes, describe the 2 categories of pension plans and the shift that is occurring in their relative popularity. Discuss 3 types of personal employee service and 6 types of job-related services offered to employees, and explain how to set up a flexible benefits program. Employee benefits. Now, indirect financial payments given to employees, like you can talk about, vocational pay, you can talk about health insurance, life insurance, may include supplementary health and life insurance, vacation, pension, education plans, and discounts on companies' products. Becoming a larger part of total compensation, useful in attracting talent, and increasingly important for aging workforce. This table 9.1 is objectives of a benefit strategy. Now, objectives of benefit strategy and percentage of organizations that rated the objective is very important. Complying with accounting, regulatory, and company standards, 53%, containing benefit cost, 45%, attracting talent, and maintaining competitive position, 39%, retaining talent, reducing turnover, employee health, say 30%. Government mandated benefits. EI, employment insurance, and we all know that in the absence of a regular income, the government provides the financial support to individuals, those who lost their job, none of their fault. And employers, they contribute 1.4 of their employment insurance, premiums. Pay on termination of employment, leaves of absence, Canada Quebec pension plan, workers' compensation, vacations and holidays, and paid breaks. So these are the government's, mandated employees' benefits. So here, employees' benefits, government mandated versus volunteer. So these are the volunteers, and these are the government mandated. Now, life insurance is a voluntary, short-term disability plans, sick plans, leaves, supplementary health care, medical insurance, long-term disability, and retirement benefits. EI, a federal program that provides income benefits if a person is unable to work through no fault of his or her own. Eligibility, benefit period, funding, supplementary unemployment benefits. So, they give the income when an employee, because of his or her no fault, is unable to find a job. Pay on termination of employment does not apply to those on a short-term contract or fired for just cause. Amount of payment varies according to jurisdiction and circumstances. Pay in lieu of reasonable notice. Severance pay Ontario and federal jurisdiction only. Pay for mass lays off some jurisdictions. Leaves of absence, unpaid time off. People they need a break to for the loved ones, for family members, or maybe for education reasons they want to upgrade at their own. So they need they apply for a leave of absence. So unpaid time off. Conditions vary by jurisdiction. Employer must guarantee same or similar job when employees returns. Common terms: maternity, parental leave, parental adoption leave, bereavement leave, compassionate care leave. Canada Pension Plan. Programs that provide basic level of security in retirement. 3 types of benefits: retirement income, survivor or death benefits, and disability benefits. Benefits based on individual contributions made. So the employee, for example, their payroll cycle, if one payroll cycle they're paying $100 for one employee, so the employer has to match that $100 in order to remit to CRA. In 2012, significant changes to retirement pensions, the deduction for each month an individual collected CPP before the age of 65 was 0.5%. The value is currently increasing and will be 0.6% by 2016. So it keeps going on. The CPP, the contribution has gone up significantly. There is also an increase in the value of the increase of to payouts for those who delay retirement consider. So let's say 65, you want to keep working on. So there's a benefit for those individuals in terms of payouts. Workers' compensation, another employee's benefit, no-fault insurance plan, income medical benefits to victims of work-related accidents or illness regardless of fault. Funded collectively by employers, administered by jurisdiction workers' compensation boards. Premiums for most employers depend on number of claims and amount of dollar paid. Vacations, holiday, and paid breaks. Vacation, minimum amount of paid vacation must be provided to employees. Holidays varies by jurisdiction, minimum 5 days, maximum 9 days. Paid breaks, uninterrupted break within a work day. Example, 30 minutes break on shift over 5 hours. Voluntarily employer-sponsored benefits, life insurance. These are the voluntary. So, I mean, if you opt this voluntarily, so you would be paying from your own pockets. So here, figure 9.1, top benefits choices among Canadians. So additional week of paid time off. A lot of Canadians, they ask for that. $500 salary increase, $500 employer contribution to retirement saving plan, $500 towards improved health dental coverage. So all the way down to the bottom, like $500 child care voucher. Life insurance, again, voluntarily employees benefit. Group plans offer lower rates and inclusion of all employees. Additional benefits, accidental benefit and dismemberment coverage, critical illness insurance. Now, here's a thought process for use as a student. Additional life insurance coverage is sometimes made available to employees on an optional employee paid basis. So it would be coming from employees' pay stub. Name the 2 benefits of coverage available and what does each type of insurance cover. Share your answers, give example of each. I think you can talk about accidental death and critical illness insurance, benefit as well. Supplementary health medical insurance, supplements provincial health plans, group rates lower than medical rates, individual rates employee usually pays a yearly deductible amount, usually includes prescription drugs, private semi-private hospital rooms, other hospital costs not covered by provincial plans. May include dental, vision care, and hearing aid. So these are extra supplementary benefits for employees. Reducing health benefits cost, increase amounts paid by employees, restrict drugs paid for by plan, health promotion, and healthcare spending accounts. So on-site employee fitness center is one option where employees can go and do exercise, try to fit themselves in order to be be healthy. Figure 9.2, increase in health plan costs from 2006 to 2010. So look at that. In 2010, 15%, and now 2000. So starting from 2006, 13.2, all the way up now in 2010 is 15%. So the cost of the healthcare plan has gone up, and it's keep going up. Another thought process for you as an individual students, the HR numbers provides a quick snapshot of the effort of smoking and the impact of smoking programs in the workplace. What are your thoughts on smoking cessation programs? Do you agree that Canadian organizations should complete ban smoking on the property? Why or why not? So think about, from a smoker point of view, and think about non-smoker point of view and health conscious. Short-term disability and sick leave plans, another benefits to employees, provides income to employees when absent due to non-work related injury or illness. Not feeling good, so you call and they give a day off, right? Requires medical certificate. usually covered by insurance company. Sick leave plan provides income for 2 or 3 days. Usually specified number of sick days per year. Canadians abusing sick time. So 2013 study of 1,513 Canadians. Out of that, 54% of Canadians admit to calling in sick when they are not sick. So abusing a system. The reasons include feeling stressed or burnout, 65%, needing to care for a sick child, 35%, having too heavy a workload, 13%, having insufficient paid vacation days, 12%. So being a HR, you need to look around those numbers. And if the sick time is getting too much, so you can work around, the number of vacation days if you offer them. So hopefully they would not call a sick. They won't abuse the sick time leaves. Long-term disability plans, income to employees for absence due to non-work related long-term injury. I think that this is what, the long-term disability, usually 50% to 65% of pay, they get. Accelerating trend in claims, disability management, mental health issues are leading cause of disability claims. Top challenges in improving how mental health issues are addressed in the workplace. So here, employee perception and stigma related to mental health issues, 60%. These are the challenges, and being a HR, you need to address, and you need to have a strategy to overcome those. Sabbaticals, time off to rejuvenate or pursue personal goals, like maybe education, upgrading. Usually unpaid helps retain employees and avoid burnout. Explain the difference between defined benefit pension plan and a defined contribution pension plan. Share your answers. So defined benefit pension plan and defined contribution pension plan. Benefit pension plan, we already know that CPP, we have it, right? And supplementary, if somebody wants to work, they want to contribute more, right? Let's say the double CPP. Sometimes employees, they go for double, or they have a private contributions, a retirement contributions plan. So they go for 2 deductions, on their pay stub, so that they want more money once they retire to expend on. Retirement benefits, defined benefit pension plan, formula based on earnings and years of service. Contribution pension benefits based on amount of contribution and value of funds, see, RRSP, and deferred profit sharing plan. So these are the 2 benefits. So we have registered pension plans. By 2016, defined benefits plan 57%, defined contribution plan 37.5%, gender male and female. It's giving you an overview how the plans, the benefit plans are Canadians opting. And here, prevalence of phased retirement programs. Now 2002 and 2,109 Canadians. So formal phased retirement, informal phased retirement, no phased retirement. Supplementary employee retirement plans, plans that provide additional benefits, pension benefits required to employees to receive full pension benefits in cases when full pension benefit exceeds maximum allowable benefits under Income Tax Act. Let's say yearly employee has to contribute $1,000 during from January to December, right? But they're still paying CPP in order to get more benefit, once they have a financial freedom once they get to retire. Employee services, personal services, and job-related services. So personal services, credit unions, counseling services, being the HR in the organizations, employee assistance programs, other personal services, social and recreational. Job-related services, subsidized childcare, like give a discounts on child cares. elder care, subsidized employee transportation, food services, educational subsidies, like a discounts you give them. Executive prerequisites, perk, management loans, salary guarantees, golden parachutes, financial counseling, relocation benefits, outplacement assistance, company cars, chauffeured limousines, concierge services. These are for executives. Flexible benefits program, individualized benefits plans to accommodate employee needs and preferences. Constraints, employer must limit total cost for each benefit package, and benefit plans must include certain items that are not optional government mandated funds. Benefits administration, how to look after approaches use of software. You can use a software, outsourcing, and benefits communication must provide correct, up-to-date information when they need. Employees need, ensure compliance with legislation, and intranet increasingly used, like the web within web, like intranet portal, like businesses, companies, they come up with a portal where they have announced certain benefits for employees. So this is it. Employees benefits and services we talked about, and we talked about the learning outcomes. If you have any question, please write down, and once we come live, you would be able to ask the questions, and I can answer those questions. So till then, I'll see you in our next learning or video. Bye for now.